Well, workplace culture in the Australian disability sector is under enormous pressure in the wake of the pandemic and 8 years of the NDIS. Fran Connolly is CEO of Fran Connolly Culture and Communications and joins us now to delve a bit deeper and address some of the main concerns. Welcome to Ticker News.
Thanks, Adrian. Hi.
So tell us a bit more about the pressure. What does it look like within these sectors at the moment?
Well, at the moment, there's massive pressure on the disability sector, and it's fair to say it's not just the pandemic. We're now, as you mentioned, we're in our 8th year of the NDIS, and there's pressures coming from all sorts of places. Firstly, there's a massive workforce shortfall. In the sector, we're currently experiencing a labour crisis. Something like 83,000 more support workers have to be found by 2024. And at the same time, providers are looking at a staff turnover rate of between 17 to 25%. So this is a huge ask. The second issue is quality. The NDIS has imposed really a transactional business model onto a service that really relies on the strength of long-term trusted relationships. So it places enormous pressure on a frontline support worker if they don't have the time and the training to do their job correctly, because the third thing is there is no money for training and development thanks to the NDIA's artificial price caps. And finally, because of the NDIS, it's a demand-driven model. So that means that workers are now working shorter shifts across often multiple employers just to earn a decent living. So we've got a very fragile workforce at a time of massive change.
So tell us what that then means for the workplace culture. It must do some damage, I imagine.
Well, it does. It contributes to the staff turnover rates I've just mentioned. But I guess too, to see it in the context of a pandemic, over the last 2 years, it's fair to say that this workforce was largely forgotten in the pandemic. Off the bat, support workers weren't granted essential worker status, and providers were told to find their own PPE. And in terms of the vaccine rollout, providers have been playing catch up ever since the Department of Health reprioritised the vaccine that was intended for disability residents in shared homes to the age. Suddenly, people with disabilities were put to the back of the queue, and so were their support workers. So I guess it's fair to say the workforce is extremely anxious and fragile at the moment.
So what can be done and also what do you think will be done? Because there's a difference between what needs to be done and then what actually gets changed. What would you like to see?
Well, look, I'd like to see a greater focus on the actual employee experience at the front line. Disability support workers, I guess along with aged care workers as well, are not only undervalued and underpaid, they're also undertrained. And yet these are the people that we're expecting to look after our most vulnerable. I think that we need to completely reassess how we treat those people who are caring for people with disability in the community and put a greater focus on building a genuine career path, not one that's sort of hamstrung by the poor wages. Offer people training and really give them the skills they need to deliver on the job. I think that workplace culture and the quality and quantity of the workforce are some of the greatest strategic issues facing not just the disability sector, but also the success of the NDIS.
Fran, thanks so much for your time today. Really appreciate sharing the message and keep us up to date with what takes place moving forward.
Thanks for the opportunity, Adrian.